What is RFA, radio frequency ablation? So RFA is a way of destroying cancer tumours by using heat, and there are a few ways to do it, but they all involve needles that are heated up by radio waves. The needles are generally about 1 or 2 millimeters in diameter, and they're placed into the tumour and then heated to ablation temperatures, which are temperature high enough to destroy cancer cells. And they may have a immunotherapeutic effect as well, meaning the heat may stimulate the immune system, because the area around the needle will get warm as well, maybe to fever temperatures, which seems to have an immunotherapeutic effect. The needles may be placed through the skin, or can be done using like an endoscope or laparoscopy. So like you do with keyhole surgery or something like that, can be done during surgery, and it has to be guided either by a CT scan or by ultrasound. It can be done under general anaesthetic and may also sometimes be done by local anaesthetic. So general anaesthetic is when you're asleep, unconscious. Local anaesthetic is where you're conscious, sedated, but you'd have anaesthetic to stop the pain in that local area. So RFA is used for tumours in the liver, the lung, kidneys, the bones, and it's a really remarkable treatment for various reasons. So I think it's most well known for treating tumours in the liver. Now, when I say it's for liver, lung, kidney, or bones, it could be either cancer that started in those places or cancer that spread to those places. So imagine the cancer has spread to the liver. RFA may be an option, a possibility. One of the points about having RFA for liver tumours compared to surgery or radiotherapy is that the liver continues to function normally with RFA. So there's no sort of temporary loss of liver function, which is really important, because if you have liver surgery, you need to stop the chemotherapy before the surgery, and you can't restart it straight away. You have to wait for some time after the surgery. Same with radiotherapy, depending on what the chemotherapy is. So RFA may be a really good option. RFA is one of those treatments that there's some kind of resistance to it in oncology. It's a minimally invasive treatment. You can have multiple treatments. You can have multiple treatments if it works. You may need multiple treatments if there's a large tumour or several tumours. You can also have multiple treatments if it doesn't work. So you have kind of multiple attempts, which is great. And most importantly, I think, if it doesn't work, it probably won't harm your chances of having another option. So if you're considering liver surgery, for example, you may be able to have RFA, and if the RFA doesn't work, then you could still go on and have the liver surgery. If the RFA does work, then you've avoided the liver surgery. You'll sometimes hear the term MFA. So RFA is radiofrequency ablation, MFA is microwave frequency ablation. It's still radio waves just using a different frequency. But microwave frequency ablation, there's more power there. So that would be useful in a situation like in some places in the liver where you're close to the big blood vessel. There's a strong cooling effect from the blood vessel, so you'd probably need the MFA, not the RFA. As I mentioned before, the needles are about 1 or 2 millimeters thick. Depending on the size of the tumour and the location of the tumour, it's often done in a two-step process where a sleeve is put in first. Like a sleeve is inserted, and then the needle. And this is a safer way of doing it because when the needle's being taken out with the sleeve, the person doing the treatment will put essentially a sponge in the sleeve coated with cytotoxic compounds, so things that kill cancer cells. And this reduces the risk of what they often call like tumor seeding. So there's a chance that if you put a needle into a tumor, when you pull it out, you could spread cancer cells around. So this two-step process is safer using a sleeve. RFA is done by different departments depending on the hospital. It's often done by the radiotherapy department or radiology department because, as I mentioned, it's scanner guided, so you need to, the clinical technician doing it needs to be able to see what's happening inside you with a CT scanner or I think more commonly ultrasound. From a patient's point of view, procedure takes maybe 30 minutes to a few hours. You may just be sedated in the same way as when you take like a colonoscopy or a gastroscopy. In which case, like you'd go in, you'd have some maybe local anesthetic gel put on the area, and then proper local anesthetic kind of injected into the area. I guess that, I don't know if that happens before or after the sedation. Anyway, get sedated, and you're brought around later in the recovery room. You're often going to be staying overnight in hospital after the procedure just for safety, and then a few weeks or a couple of months later you're going to have a CT scan or an MRI scan to see how it went. There are kind of guidelines about what situations you can use it, and it depends on the country. It's not a new treatment, but it's kind of a newish treatment, so the guidelines might be a bit out of date. I know in Japan the guidelines were just talk about liver guidelines. The guidelines were you can potentially do RFA if there's 3 or fewer tumours and the biggest tumour is smaller than 30 millimeters across. But those guidelines were based on primary liver cancer, and it's since been found out that for example, for colon cancer spread to the liver, it can be worth doing it if there are loads of tumours. It can be worth doing it if the tumours are quite big. In some situations, you can do RFA as a step towards liver surgery. There may be situations where tumours in a place that can't be removed by liver surgery because it is dangerous near a big blood vessel that you don't want to get damaged. So I hope that's given you some useful information on RFA. I personally think it's a treatment that should be absolutely aggressively pursued, funded massively, because it's a treatment where for some patients, if they try it and it doesn't work, they can still go and try another treatment. So that's really, really important. It keeps your options open. And as I mentioned before, for RFA with the liver, you don't have the decrease in liver function that you would with radiotherapy, obviously surgery. If you're cutting half your liver out, it takes some time for that to recover. So I think it's a treatment that should be aggressively pursued. So please find out if it's an option for you. Okay, thanks for watching.